My name is Bryce Sanchez, and I am a second-year medical student at the Oklahoma State University Center for Health Sciences, and I am here to talk about data sharing and anesthesia research. Data sharing statements are important in medical literature, specifically for the topic of transparency. Because anesthesia is a growing field of medicine whose research also continues to grow, we wanted to look at the top 5 journals of anesthesiology and their compliance to providing data sharing statements in their publications. We found this year's Clarivate Journal citation reports, which included Anesthesia and Analgesia, British Journal of Anesthesia, Journal of Clinical Anesthesia, Anesthesia, and Anesthesia, Critical Care and Pain Medicine as the top 5 journals in the field of anesthesia. Once we obtained this, we performed a search string on Medline on articles published between 2020 and 2023 that focus on topics including, but not limited to, treatment, clinical trials, and primary patient data. We excluded letters to the editor, systematic review and meta-analyses, responses to readers, editorials, and non-human studies. When we full-text screen each article, we look for the presence of data sharing statements, themes, and authors' responsiveness to data sharing requests. Among the eligible 1,123 articles that met our inclusion criteria, only 95 total publications provided a data sharing statement of any kind. If we look at the results in Table 1, we see an overall theme that less than 25% of the articles from any journal contained a data sharing statement that was accessible. Anesthesia, Critical Care and Pain Medicine had the highest percent of articles with data statements, in which we actually found an increase of 15.4% in 2020 to 30% by 2023. The rest of the journals were significantly less in terms of compliance for data sharing statements for all 4 years we looked at. In Table 2, we can see that government-funded research showed a positive correlation with data sharing statements, whereas higher impact factor journals exhibited a negative association. Overall, Elsevier publicated journals had the highest compliance compared to Wiley and Lippincott. Overall, our analysis revealed significant deficiencies in data sharing practices throughout the top 5 leading anesthesia journals. This highlights the need for action of journals to increase the availability of their data so that we may see an increase in transparency, reproducibility, efficiency, and collaboration among further research topics in this field. Addressing this issue emphasizes the need for implementing policies in journals and government-funded projects that may ultimately lead to an improvement of data transparency and reproducibility to advance open science and outcomes in this field.